most important meaning of a rare disease and of a diagnosis in general is to find the optimal treatment for the individual patient. So that means you have to, but that's in general, you have to look at the patient from a holistic perspective. You have to do the technical examinations on one hand, like the MRI scan and the EEG recordings, of course, video EEG recordings if possible and indicated. Not to forget the traditional means of establishing a diagnosis, taking the history from relatives, family, and caregivers, and the clinical examination, of course. If we are talking about rare diseases, then it is especially important also to consider the genetic diagnostics. So in those patients in whom we do not find an etiology of their epilepsy, by means of EEG, MRI, and so on, we should do genetic testing according to the most modern standards, especially if these are patients with an intellectual disability. So this is one of my most important field of clinical and research activities, to care for persons with epilepsy and intellectual disability, because this is a highly neglected patient population, and focusing on rare diseases, we have the opportunity to care better for them.